Your hair is falling out on Zepbound or Ozempic. Zepbound can look worse, but not for the reason people think. The real trigger is rapid weight loss, and because hair shedding is delayed by 2 to 3 months, most people miss it. Slow that down early, and you can often stop it before it gets worse. People notice it suddenly, in the shower, on the brush, in the mirror. The shedding you see now may have started 2 to 3 months ago. That gap is what makes this so easy to miss. Most people never connect the two. Once you understand it, you can actually do something about it. I'm Dr. Kim, and what matters here is not the drug. It is how fast your body is changing. This is not medical advice. Consult your doctor. Zepbound, also called tirzepatide, and Ozempic, also called semaglutide, both reduce appetite and slow how quickly food leaves the stomach. Hair loss in this setting is usually not about the drug directly damaging hair. It is more often a condition called Telogen effluvium, a temporary stress-related shedding condition. That is when a large number of hairs enter the resting phase at the same time. They shed later, usually 2 to 3 months after the trigger. That delay is why the timing feels wrong. Most people think hair loss means damage. In this case, it is usually a stress response. The body hit its limit faster than it could recover. Weight loss, especially rapid weight loss, is one of those triggers. Reduced calorie intake, lower protein, and shifts in hormones can all contribute. When calories drop suddenly, your body treats it as stress. Here is where most people focus on the wrong comparison. They ask which drug causes more hair loss. But the rate of weight loss matters more than the drug itself. If Zepbound leads to faster weight loss in some people, it can appear worse. But that is usually because the pace was faster, not because the drug was stronger. The hair loss you see today often reflects what your body experienced 2 to 3 months ago. The signal is delayed, and by the time shedding becomes visible, the trigger has often already passed. Now here is the uncomfortable truth. Hair loss here often means one thing: your body is under more stress than it can handle right now. And if you keep pushing the same pace, the shedding usually gets worse, not better. If you want the shedding to slow, start here. First, control the pace. Losing more than 1 to 2 pounds per week gives your body less time to adapt. Hair is one of the first systems to show that strain. Second, protect protein. Hair is made primarily of protein. When intake drops, the body simply stops prioritizing hair growth. Most people on these medications are getting far less than they need. A rough target is 1.2 to 1.6 grams per kilogram. But age, kidney function, and overall health all affect that number. Third, keep eating consistent. Large swings in calorie intake amplify the stress signal the body is already receiving. Stable patterns reduce that effect. This is where people think they are being disciplined. They are actually making the problem worse. They cut food intake even further when appetite drops. That feels efficient, but it increases the stress signal the body is already receiving. That is why, if you want the shedding to stop, you do not change the drug first. You slow the pace. So the real question becomes this: is Zepbound actually worse than Ozempic for hair loss? There is no clear evidence that one drug causes more hair loss than the other. The difference you see is almost always speed. The differences people notice are usually explained by how much weight they lose and how quickly. In some studies, both medications are associated with hair shedding, but the pattern aligns with weight loss dynamics, not a drug-specific effect. So the better question is not which drug is worse. It is whether your current pace is putting your body under more stress than it can adapt to. If shedding has started, here is what to look for. Timing is the first clue. If hair loss begins 2 to 3 months after rapid weight loss, that fits the telogen effluvium pattern. Next, distribution. Diffuse shedding across the scalp is typical of this process. Patchy loss suggests a different condition and needs evaluation. Then recovery pattern. Once the trigger stabilizes, shedding usually slows, and regrowth begins over several months. New hairs tend to come in thinner at first, but most people see fuller regrowth within 3 to 6 months once the underlying stress is addressed. When should you continue, adjust, or seek evaluation? If shedding is mild and weight loss is steady, monitoring is reasonable. If shedding is severe, prolonged, or comes with fatigue or weakness, get evaluated. Basic labs, iron stores, thyroid, and zinc can help identify contributing factors if shedding persists. If weight loss has been very rapid, slowing the pace can reduce ongoing stress. That does not mean stopping the medication. It means adjusting the overall approach. The goal is not just weight loss. The goal is sustainable fat loss with minimal collateral effects. There is also a timing misconception worth understanding. Shedding often peaks after the most aggressive phase has passed, so when people reduce the dose, they expect immediate results. But hair cycles do not respond that quickly. The process was set in motion weeks earlier. That is why changes made during peak shedding often feel like they are not working. Hair grows in cycles, and each follicle runs on its own schedule. When telogen effluvium hits, those cycles are disrupted all at once, which is why recovery does not happen gradually. It tends to happen in waves. Some people notice regrowth starting within 3 months. Others wait closer to 6. The difference usually comes down to how well that stress was managed. One thing worth knowing, this cycle can repeat. If you lose weight rapidly again, after a break or a dose restart, the same trigger applies. The body builds no immunity to this pattern. One pattern worth flagging: dose escalation can trigger another round of shedding. Moving to a higher dose accelerates weight loss again. The body treats that shift as a new stress event. The same delay applies. Shedding after a dose increase often peaks 2 to 3 months later. One more factor worth knowing: low iron and zinc can worsen shedding when combined with rapid weight loss. They do not cause it on their own. But if levels are already low, the effect compounds. Consistent intake matters more than aggressive restriction. Individual response also varies. Some people experience no noticeable shedding, even with rapid weight loss. Others are more sensitive. Genetics, baseline nutrition, and prior stress load all play a role. The same drug at the same dose can produce very different outcomes in different people. Most people do not need to stop the medication. What usually matters is reviewing the pace, nutrition, and the overall plan. So here is the takeaway. Hair loss here is usually a delayed response to rapid change. It is not a direct toxic effect of the medication. The drug is rarely the problem. The pace of change usually is. Adjust the pace, protect protein, and keep nutrition stable. The system often corrects itself. If you control the pace, you usually control the outcome. Your hair is responding to the speed of change, not just the drug itself. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.